Have you ever listened to a doctor and felt like they were speaking a different language? Well, today we're going to tackle the language of surgery, and I'm going to let you in on a little secret. It's not a language you have to memorize. It's a code, and we are going to crack it.
Listen to these words: thoracentesis, lithotripsy, gastrorrhaphy. It's so easy to just tune out, right? They sound super complex, totally technical, and yeah, pretty much like a foreign language. But here's the thing, they're not random. Every single piece of these words has a job to do.
And that's the key. It really is a code. Medical terms are just a system built from these little interchangeable parts. Think of them like Lego bricks. Once you learn what a few of the key bricks mean, you can start to build and understand almost any term you hear. So let's do this. Let's crack this code together.
Okay, so we're going to start at the end of the word with the suffix. Why? Because the suffix is usually the most important part of a surgical term. It tells you what the surgeon is actually doing. These are the action words of the operating room. Now, two of the most basic actions are also the ones that are super easy to get mixed up. Is a surgeon just making a small cut, or are they taking something out completely? The suffix tells you everything. All right, here's our first key. If you see a word that ends in otomy, I just want you to think incision. That's it. It means the surgeon is cutting into something, but they're not removing it. So a tracheotomy, for instance, is making a cut into the trachea, the windpipe, to help someone breathe. And on the complete flip side, you've got ectomy. This one is final. When you see ectomy, it means something is coming out. Surgical removal. Gone. So an appendectomy is the removal of the appendix. A splenectomy, they're taking out the spleen. Just remember, otomy is in, ectomy is out. This brings us to a third, related action, ostomy. Now this one is a little different. It means to create a new artificial opening, what's often called a stoma. You see this in procedures like a colostomy, where a new opening is created from the colon to the outside of the body. So it's not just cutting in, it's creating a whole new pathway. Of course, surgery isn't just about cutting and removing, right? A huge part of the job is about fixing things, repairing them, stitching them up, and securing them in place. So let's look at the suffixes that tell us something is being repaired.
And what's so cool here is how incredibly specific this language is. It's not just one general word for fix. You've got plasty for surgical repair, like a rhinoplasty for reshaping a nose. But then you also have pexy for fixing an organ in place, rhaphy just for stitching, and even desis for fusing two things together, like in a joint. The precision is just amazing.
All right, we've got the action words down. Now let's shift gears and look at the viewing words. How do doctors actually see, record, and measure what's going on inside our bodies? Well, once again, the suffixes tell the whole story. So anytime you see scopy, just think to view. An endoscopy is the process of viewing the inside of the body, and the tool they use to do that viewing, that's the scope, like an endoscope. So scopy is the action, the verb, and scope is the tool, the noun. Simple as that.
Okay, now here's a subtle little distinction that's actually really important, especially when we're talking about taking pictures or recordings of the body. There's a word for doing the work, and then there's a different word for the thing you get at the end.
Think of it this way. Graphy is the verb. It's the process of taking the picture. So mammography is the process of getting a breast x-ray. But the actual image, the thing the doctor holds up to the light, that is the gram. That's your mammogram. Process versus result.
And to round out this section, we've got metry. This one's pretty straightforward. It just means to measure. And you see this one out in the real world all the time without even thinking about it. Optometry is literally the profession of measuring people's eyes and vision.
Okay, code breakers, this is the moment. This is the payoff. We have our keys. We've learned the suffixes for actions, for repairs, for viewing. Now, let's actually use them to decode some of those big, scary, real-world medical terms.
Let's start with a really common one you've probably heard a million times. Electrocardiogram. I know, it's a mouthful. It looks intimidating. But let's just break it down piece by piece using the tools we just learned.
So let's pull it apart. We start with electro, which, you guessed it, means electricity. Then we have cardio, which is a super common root for anything to do with the heart. And the last piece, the one we just learned, is gram. And what's a gram? It's the recording itself. And boom, there you have it. An electrocardiogram is just a recording of the electrical activity of the heart.
See how that works? The huge, intimidating word just melts away once you see the building blocks. Pretty cool, right? Let's do another one.
Okay, you ready for round 2? This one sounds even more intense. Lithotripsy. This term mixes a word for a very specific thing with a pretty powerful action suffix. Any guesses what might be going on here?
Let's break it open. The first part, litho, means stone. You'll hear this a lot when talking about things like kidney stones or gallstones. The second part, our suffix, is tripsy, and that one means to crush, literally crushing something.
So you put it together, and lithotripsy is a procedure for crushing a stone. They often use things like sound waves to break up kidney stones so they can be passed more easily. Once again, a super complex word becomes a really simple descriptive phrase once you know the code.
So, cracking these codes has been a fun little puzzle, but there's a much deeper reason why this actually matters. Understanding this stuff isn't just a party trick. It's a genuine tool for empowerment when it comes to your own health. Think about it. When you can break down these terms, you're not just nodding along anymore. You can actually understand the conversation about your own health. You can ask smarter, more specific questions about a procedure. You can take a way more active role in your own healthcare journey. It totally changes the dynamic, from medicine being something that just happens to you to something you can actually participate in.
You know, we've really only scratched the surface today, but you now have the fundamental keys to start decoding the language of surgery. So the next time you hear one of those big medical words, don't shrink away. Take a second, look for the pieces you recognize, break it down, and see what you can figure out. You've got the tools. The only question is, what will you unlock next? Thanks for tuning in.